Madam Speaker, this government speaks of attachment to primary care. The Nova Scotia Health site states the registry is for people who need attachment to a family doctor and nurse practitioner. Last week when I asked the minister a question about the number of people on the Need a Family Practice Registry, the minister said people can be attached to pharmacists, physiotherapists, and other primary care. I agree. Can the minister provide a clear answer for Nova Scotians? What does the minister exactly mean when when someone is attached to primary care? Will that or does that include a family physician at some point in time?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. So I think it's important that we talk wherever possible. We actually want to attach Nova Scotians to a team-based care. It does include physicians, includes nurse practitioners, it includes family practice nurses, sometimes a social worker, perhaps other allied healthcare providers, sometimes a pharmacist. This is a modern way that new physicians have told us that they want to practice. They no longer want to be a single door that does everything from ear piercing to palliative care, which is what we are accustomed to in this province. We had one door to go through with family physicians. They did everything from soup to nuts. That is not the case anymore. People are asking for team-based care, and we're proud of the work that's happened, that we're able to deliver that, which has resulted in 94% attachment in our province.
I recognize the Honourable Member for Halifax-Armdale.
Madam Speaker, virtual care, primary care clinics, social workers are an important point of care for Nova Scotians, especially when they're on a need for a family practice list. But these aren't substitute for long-term primary care teams with a doctor or a nurse practitioner who knows you and your health concerns, someone your family can count on long-term, not just episodic. This is what Nova Scotians have been asking for. Therefore, my question to the Minister, if someone is seen at a pharmacy care clinic or through a virtual care, are they removed from the Need a Family Practice Registry or put on another list called Primary Health Connect?
I recognize the Honourable Minister of Health and Wellness.
Thank you, and I thank the member because it gives me an opportunity to talk about the incredible progress that's been made around attachment as well as access. So if you're on the Need a Family Practice Registry, you have unlimited virtual care appointments. If that provider, which is generally a doc or a nurse practitioner, feels you need to be seen in person, you then go to a primary care clinic, of which there are 19 across the province. The folks that work in that primary care clinic can then follow you either for that episodic period of care that you have, or perhaps they're going to keep you under their care until a permanent primary care provider you can be attached to. This is an incredible system. We should be celebrating the work that's happened around this. It's not my work, it's the work of healthcare professionals. They're experts in their field. They're providing incredible care to Nova Scotians, and we should be championing this instead of tearing it apart.